some younger people still desperately need hormone replacement. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas, and I'm coming to you this week with a video that could change your life or the life of someone you really care about. Now, promise, you need to share this one because you have loved ones in your network that need this information, some of them desperately, even if they don't necessarily know they need it just yet. So what we hear a lot is, I'm too young for hormone pellets. That's a common thing to hear. Creekstone Integrated Medical here, we now offer hormone pellets as part of the medical services under our medical director and nurse practitioner. So we know a thing or two about this. As far as hormones go, there are the big three that these folks can absolutely benefit from hormone optimization, and we're going to cover them right here briefly. Number one, menopausal females. Understand that they need hormone replacement, also known as hormone balancing, hormone optimization, hormone pellets. Anyways, menopausal women, it's just a given. Now, females that have gone through a hysterectomy, they know without a doubt that they're going to benefit from hormone pellets. And then the last group of the big three are older males with low T, low testosterone. It's just a given that these pellets are going to be a game changer for those folks. But what about the other people that fall into the gaps? Who else can benefit from hormone optimization? Well, here's a short list of those that may not fit into the big three, but should still have a simple blood test to find out where they are as far as their hormone levels go. So get the simple blood test to check hormone levels if you suffer from one of the following here: a lack of libido, unexplained weight gain or weight loss, abnormal pain, anxiety and irritability, poor sleep, brittle or weak bones, changes in sensitivity to cold and heat, very dry skin or rashes, headaches, long-term fatigue with no real reason for it, unexplained or excessive sweating, brain fog, or inability to concentrate. Now, those are overall symptoms of hormone imbalance for both men and women. And you can learn more about this if you'll go to www.avexapel.com. Now, more specifically for men, the symptoms are brain fog, hair loss, decreased sex drive, irritability, changes in mood, depression, chronic fatigue, body fat increase, erectile dysfunction, muscle loss, lack of concentration, and sleep issues. For more on male symptoms, I'll include the link right here. Now, when we talk about women specifically, the symptoms are as follows: irregular cycle, dryness, night sweats, bone loss, breast tenderness, GI issues, depression, chronic fatigue, hot flashes, cold hands and feet, low or no sex drive, mood swings, sleep issues, and thinning or brittle hair. Again, for more on females specifically, follow the link below. So as you can see, plenty of patients fall into the non-big three gaps and are missing the boat, or the benefits, I should say, of hormone replacement therapy. So quick story. Susie has been a long-time patient of Creekstone. She's been suffering from headaches for over 1.5 years now and has been basically eating ibuprofen for that amount of time to try to live with these headaches. And I have to say, as a chiropractor, I am really, really good with headaches. But I haven't seen her for 1.5 years solid, but when we have seen her, we've just had real limited success controlling these headaches. I have to say it, unfortunately. Most headaches we knock out. These, I just couldn't. So she took a chance, and she had her hormone pellets right here at Creekstone just a few weeks ago. Now, the first week, she had no headaches at all. Not one ibuprofen was taken. The second week, she had 1 or 2 very minor headaches. With the third week and beyond, after her hormone levels have really begun to sink in and rise, She's had 0 headaches, not taking ibuprofen, nothing. And she hadn't gone hardly a day without a headache in over a year and a half. Her life has changed almost overnight, and we're so proud to have played a part of it. Now, that's been a very dramatic change. So let's talk about a more subtle change with a patient we'll call Darla. Well, Darla, she's in the professional world, and she's awesome. She's a go-getter and very well respected in our local community here. And she's such a go-getter that by the time she used to get home every night, well, the tank was just empty, and there was very little left for family time a lot of the time. So does that sound familiar? I know I can relate. I feel that way fairly often, actually. Darla got her pellets about 5 weeks ago, and things are different now. She gets through her days the way we're meant to get through the day. She has energy left when she gets home, and she spends more quality time with the family after work. Most importantly, she sleeps better every night. And research is very, very clear that good sleep is one of the most effective ways to control long-lasting and lingering chronic pain. So it's a win-win. Again, a simple blood test can tell if you're a candidate and can benefit. The appointment for pellets itself only lasts about 15 to 20 minutes or so. It doesn't take long. The Vexapel pellets we use are coated in a steroid, so any inflammation is reduced and healing time is cut down significantly, to the point that patients are really doing very well. I mean, it's not a big procedure to start with, but really they're kind of over it in 2 to 3 days for the most part. Some less, some more. So I encourage you to call us at 806-355-3000 for a free consultation. Or if you prefer, we can just go ahead and get that blood test set up for you to find out if you're a candidate. Either way, we're here to help you and be a resource of information on hormone pellets right here in Amarillo, Texas. If you're watching on YouTube, please subscribe, comment, and please consider sharing. If you're on Facebook, please like, comment, and share. Every bit helps us reach the folks that really need us. This is a game changer, folks. A literal game changer. Again, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas. Until next time, be safe, and we'll see you in next week's video.